Hello, on behalf of the El Paso Harm Reduction Alliance, my name is Jamie Bailey. I'm one of the chairs for the Alliance. I'm a person with lived experience with substance use and mental health issues, as well as a person in long-term recovery. And today, along with my team members, we're going to be presenting on overdose prevention centers. I want to give the opportunity to our team members to introduce themselves. I want to give a shout out to Jamie Diaz, who helped to create this presentation and whose idea it was for the Alliance to start thinking about overdose prevention centers here in El Paso. That's Jamie Diaz, who is now with the Texas Harm Reduction Alliance. And then Chris, would you like to introduce yourself?
Sure. Hi, everybody. My name is Chris Bailey. I'm a person in long-term recovery. I'm also a person with lived experience. I am a project coordinator in the El Paso area with a health clinic, and I am also a harm reductionist. And I'm really grateful to be here conducting this this training for y'all. Thanks so much, Jamie.
We have Christine. Would you like to introduce yourself?
Thank you, Dean Zimmerly, and I'm a cisgender harm reductionist in long-term recovery from substance use disorder and mental health challenges. I've volunteered with the El Paso Harm Reduction Alliance since 2019, and I'm here to learn and share knowledge, and I'm interested in all practices that save lives.
Thank you, Christine. And we also want to thank Jorge Puentes and Mariah Alvarez, also chairs of the El Paso Harm Reduction Alliance, for their assistance and their role in helping to create this presentation. Thank you, Jorge and Mariah. During today's presentation, there may be some concepts, images, or words that may be activating. So we want to please encourage you to step out if you need to. EFRA would like to always promote self-care and wellness, and we ask that anyone watching this presentation prioritize their mental health and their emotional well-being. So for today's objectives, we're going to discuss what overdose prevention centers are. We're going to look at different kinds of models that exist for overdose prevention centers, some proof of concepts that exist around the United States and the world in overdose prevention centers that have been established, as well as looking at some evidence-based research that exists supporting the efficacy of overdose prevention centers. Christine's going to guide us through debunking some of the myths associated with overdose prevention centers and showing the facts that show that they work at helping to save lives. And then we'll end with a discussion on how we can get started in our community in making overdose prevention centers a reality here in El Paso. Throughout our presentation, we're going to be using some abbreviations on the screen. And you can take a look at what some of those abbreviations mean. And you can just take a note here that we always strive to use person-first language and avoid the use of stigmatizing language. All right. So over the past 30 years, overdose prevention centers have been deployed at more than 100 sites in more than 60 cities in 11 countries around the world. These sites are called different things depending on where you are in the world. They're sometimes called overdose prevention sites or safe consumption sites, or they are route of administration specific, and they're called injection sites. But for our presentation, we're going to be referring to them generally as overdose prevention centers. And something that's really incredible to note is that to date, no one has ever died of an overdose at any of these sites. There are many benefits to overdose prevention centers, and they may include increasing entry into substance use disorder treatment, including medication for opioid use disorders, because not only are people given the availability and the access to a safe place to use substances, but they're also offered referrals to resources or even provided those resources on site. They can also help to reduce the amount and frequency with which people use substances because they have a safe place to go to use substances and they're not having to use in places like a public bathroom or out in the street where they have the fear of incarceration or getting caught by police. And so they're using a large quantity, helping to, again, reduce overdose risk. Overdose prevention centers also reduce public disorder and public injection while increasing public safety. They reduce HIV and hepatitis C risk behaviors, like sharing used equipment or syringes, by providing people who are using overdose prevention centers with new sterile equipment. They also help to successfully manage frequent overdoses on site and reduce drug-related overdose death rates. They help to save money due to reduced illness, reduced overdose deaths, and the need for emergency medical services. They can increase the provision of medical and social services. Overdose prevention centers are controlled settings which may be staffed by health professionals or peers, where people who use drugs can use their own personally acquired substances under the supervision and monitoring of trained personnel and receive healthcare, counseling, and referral to social health and substance use disorder treatment services should they want them. Overdose prevention centers are designated sites where people can use pre-obtained substances under the safety and support of trained personnel. The types of substances consumed and the routes of administration may vary depending on each site. An example of a safe consumption site in a community is a bar. A bar is a place where people can go and consume a substance under the guidance of somebody, a bartender, who supplies them with alcohol, which is a substance. It's a safe supply, and makes sure that the person is monitored, that they don't overconsume, and that they are not a risk to themselves or others if they become intoxicated. A taxi is called or an Uber, and the bartender makes sure that the person gets home safe. And so it's not such a radical concept. We already have places where people can safely consume substances. We also have unsanctioned overdose prevention centers already operating in our community, places like picaderos, here along the border, where people, communities of drug users are gathered together and use substances and watch out for each other, reverse overdoses should they occur. So we're going to take a look at different types of models that exist for overdose prevention centers, including integrated, specialized, mobile, female only, and unsanctioned. So an integrated overdose prevention center is one of the most common types, and they are usually part of many services provided in a single facility. These include places like drop-in centers where people can receive counseling and testing for blood-borne viral infections. They can also exchange syringes, for example, receive medication for opioid use disorder, and medical services. A great advantage of this model is that it increases the access to services to people since they are housed in the same facility. Something that we want to be mindful of with this model is that individuals who may be engaging in a pathway of recovery, such as the use of medications for opioid use disorder, may be interacting with folks that are on site and utilizing substances. So we just want to make sure that all of the people receiving services in an integrated overdose prevention center are safe and that their recovery pathways are taken into consideration. Moreover, this model can be very costly and logistically complex to implement. The next kind of model is a specialized overdose prevention center. This would be a overdose prevention center that is focused solely on providing a safe space for people to utilize substances, and the referral to other kinds of services happens outside of that agency. So they're not provided within that center. People are referred out for any other services. It's just focused on providing people a safe place to utilize substances, and overdose reversal should one occur on site. Since this model is solely focused on people using substances, it is less expensive and complex to run, while also builds inter-organizational relationships through referrals. However, this same strength can also be a pitfall, as not having other services around could lead to barriers to accessing care for folks. Mobile overdose prevention centers directly service a community and are usually composed of vans, which can accommodate 1 to 3 booths at a time where people can utilize substances. Usually, these mobile vans also offer syringe exchange services and bloodborne virus testing. This model is well fit for populations that are hard to reach, such as individuals experiencing houselessness, or individuals using substances who cite clinical stigma as one of the top reasons why they will not go to a medical setting. Also people that live in remote or rural areas can really benefit from mobile overdose prevention centers. However, the counterweight to its flexibility is that not a lot of services are able to be provided, as well as that it's limited to a very few individuals at a time, since it can only accommodate 1 to 3 booths in the van. I did also want to mention that one of the principles of harm reduction is meeting people where they are. And so a street-based intervention really aligns beautifully with what harm reduction is supposed to be, which is meeting people where they are, getting out into the street. The next kind of model would be for individuals who identify as female. This includes, of course, trans women. And these overdose prevention centers are focused on exclusively servicing women and exclusively staffed by women. This is not a model per se, but instead an approach that can be applied to any of the previous models, or even female-only hours of operation. This is to provide a more accommodating, trauma-informed, and safer environment to women who use substances. 80% of women who identified as people who inject drugs, who accessed overdose prevention centers in this model, reported being more comfortable and feeling safer than in mixed gender settings. This model drives engagement in other services from clients, as well as provides a more welcoming environment to subpopulations like people who identify as female. In order for it to be effective, the organization needs to be culturally competent when implementing. This includes being culturally responsive to the community being served, as well as being trauma informed. The last model is that of unsanctioned overdose prevention centers, which we mentioned earlier. And this is any area that an individual in community with others is using substances. This can be in abandoned homes, apartments, houses, hotels, streets, bars, etc. And we know that there are a lot of unsanctioned overdose prevention centers already being operated by people that use drugs, taking care of their community. Next, I'm going to turn it over to Mariah, who's going to discuss proof of concepts.
Hello everyone, my name is Mariah Alvarez, and now we're going to be moving on to proof of Overdose Prevention Center concepts. And so we want to go ahead and focus on the above mentioned concepts. Successful safe consumption sites or overdose prevention centers have occurred in New York City, Vancouver, and various European countries. Currently in Rhode Island, legislation was signed allowing the state to focus on harm reduction campaigns. And the first ever implemented overdose prevention site happened in 1980 in Switzerland, and there are more than 200 safe consumption sites / overdose prevention centers operating in the world today. And so the first one we'd like to focus on is in New York. It's called On Point, and they do have overdose prevention centers. Since the start of the centers, almost 4,000 individuals have been serviced. The overdose prevention centers have been utilized over 93,000 times and have prevented almost 1,100 overdoses. They are the largest harm reduction center on the East Coast, and they offer life-saving drug use and overdose training to those who need it most. They also help distribute and clean up more syringes and paraphernalia than any other providers. And so again, this is On Point in New York City. Additionally, I did want to go ahead and mention Rhode Island Cares. Like I said earlier, legislation was being passed. And so in Rhode Island, between 2015 and 2020, more than 1,700 individuals lost their lives to accidental overdose. At the moment, they have not chosen a model yet for their overdose prevention center. However, they are moving forward with harm reduction. And there's a quote that I'd like to share by one of their employees, Ashley Perry, and that is, "I will never understand how we have allowed so many people to die when we know of a practical medical intervention where not one person has ever died." And lastly, moving on to an additional site in North America, opening its doors in 2003, Insight was the first ever sanctioned supervised drug injection site in North America, and they save thousands of lives and millions of healthcare dollars each year. They're operating in partnership with Vancouver Coastal Health, and the Insight supervised injection facility is a clean and safe environment for users to consume illicit drugs. And now moving outside of the US, there are concepts, as stated, that have been successful and proven to help prevent overdose. And so when we look at that, we see that in Europe, they've been operating for the last 3 decades. And as you can see from the image above, there are areas of multiple safe consumption sites. So the larger the circle, the more safe consumption sites or overdose prevention centers. And they operate, they save lives, and they're doing well. And lastly, I'd like to close out with just a question. Hopefully you're able to scan the QR code and access our poll. Just in case it's not active, I just want you to go ahead and sit with this question. And that is, how can overdose prevention centers benefit our community, your community, or any community? If you want to go ahead and send your answers in, we'd greatly appreciate it. Or if you want to just go ahead and sit on that and think about how they could help prevent death, but also just benefit your community and the benefits that you might see by having them there. And with that, my section's over, and I'd like to pass it over to the next presenter. Thank you very much.
Great. Thanks, Mariah. As Mariah showed, we have some proof of concept now on OPCs and how they work, but evidence really helps to shore up exactly what she was talking about here and how these overdose prevention centers save lives. We would like to supplement everything we've shown you with this research. If we could go to the next slide, please. So there were a series of studies conducted by the researchers listed at the bottom of the slide, which showed a 26% net reduction in overdose deaths in the areas surrounding a overdose prevention center in Vancouver, Canada, compared with the rest of the city. An overdose prevention center in Barcelona, Spain, was associated with a 50% reduction in overdose mortality rates from 1991 to 2008. That's a substantial amount of time. People who inject drugs are significantly less likely to share needles if they regularly use overdose prevention centers. And these sites or these centers could be effective in reducing the rates of both HIV and hepatitis C in people who inject drugs. Overdose prevention centers can also reduce the number of publicly discarded syringes, and they improve public safety. A 2019 article from the journal American Family Physician discusses ways that physicians can counsel patients who inject drugs about safer injection practices, including overdose prevention centers. Next slide, please. Our best evidence comes from a cohort and modeling study conducted by the National Institute of Health that suggests that overdose prevention centers, or OPCs, were associated with lower overdose mortality rates. In one case, 88 fewer overdose deaths per 100,000 persons per year. A 67% fewer ambulance calls for treating overdoses, and a decrease in HIV infections. Before the Overdose Prevention Center opened, 35% of 598 intravenous drug users were admitted to the hospital in a 3-year period, 15% for skin infections. After the Overdose Prevention Center opened, of the 1,083 OPC users over 4 years, 9% were admitted for cutaneous injection-related infections, including osteomyelitis and endocarditis. And while OPC nurse quote-unquote referrals to hospitals increased the likelihood of admission, the average length of stay decreased by 8 days, from 12 days to 4 days. In the same study, it was found that near one overdose prevention center, average monthly ambulance calls with naloxone treatment for suspected opioid overdose decreased from 27 to 9. Next slide, please. One Canadian study found that an, quote, abrupt, persistent decrease in crime occurred after the opening of an OPC. These centers reduce public nuisance because patients can inject drugs and discard used needles safely rather than in public spaces. In a study of an unsanctioned OPC in the United States, 90% of the people using the site reported that they would otherwise be injecting in a public restroom, on the street, in a park, or in a parking lot. Along with this, another study conducted by Calkins and Company concluded that there is no evidence that OPCs increase crime. Indeed, in a literature review for Westminster College, Lewis writes and remarked on the efficacy of OPCs in 3 primary areas. Next slide, please. The first is that we can reduce individuals' physical harms associated with drug use, such as the spread of HIV and hepatitis C infections and overdose. Second, by implementing OPCs, we are reducing social harms associated with drug use, such as publicly discarded syringes and injection-related litter, public crime, public drug use, and public overdose. And 3, OPCs are cost-effective when compared to others, primarily similarly effective interventions, and the price of tertiary treatment and prevention. Nearly every study on overdose prevention centers recommends the intervention for areas where we're looking at setting up overdose prevention centers in areas of our city where drug use is already prevalent. From the body of evidence, the advantage of OPCs should be heavily considered when a community is trying to prevent the harms associated with drug use. So with that evidence presented, we're going to turn it over for Christine to bust some myths for us. Christine?
Thank you, Chris. So let's take a look at some of the myths that might be dissuading communities from starting overdose prevention centers. The first one is that harm reduction is a temporary Band-Aid solution. Myth 2 is that overdose prevention centers take resources away from the healthcare system. Myth 3 is the opioid crisis only affects people with addictions. Myth 4 is that overdose prevention centers normalize drug use. Myth 5 is that overdose prevention centers make it easier for people to get drugs. And myth 6 is that overdose prevention centers will make neighborhoods unsafe. Next slide, please. Although it includes abstinence as an option if and when the person is ready, harm reduction recognizes that abstinence is not always realistic for a person with addictions. Harm reduction approaches, like overdose prevention centers, are an early and important part of a substance user's recovery process and their access to other primary care services. Harm reduction is a valid way to begin a process of change. Next slide, please. Each day, these centers can decrease healthcare costs by reducing the number of emergency department admissions. As one example, illegal drug use is often linked to the spread of infections such as HIV and hepatitis C. Given an estimated average lifetime HIV-related medical costs for a person with HIV of $420,285 according to the Health and Human Services Commission in 2019. These are future expenditures that safe overdose prevention centers could prevent. Hepatitis C treatment in the United States costs an average of $80,000 per person if affected and treated early. Considering that many substance users are uninsured or underinsured, this is a great expense and an unnecessary weight on the community, as these illnesses are spread much more easily if untreated or other harm reduction tools are not used, such as condoms or clean syringes. In Calgary, Canada, SafeWorks Harm Reduction Program was established in late 2017 and offered a 24/7 access to overdose prevention centers. The facility is a nurse-led service available for client drop-in the entire duration of the program from 2017 to 2020 for a period of 2 years and 3 months. The proportion of clients who had overdosed at the center had decreased steadily for the duration of the program. The number of overdoses that could be managed at the site at the center trended upward and currently is at 98%. Each overdose that was managed at the Overdose Prevention Center produced approximately $1,600 in Canadian cost savings, with the savings of over $2.3 million for the lifetime of the program. Please keep in mind that as well as the average cost for an acute emergency-oriented intervention for overdose costs between $32,000 and $36,000. To be clear, overdose prevention centers save money and resources for communities. This is why we already have them in most Texas communities for safer monitored alcohol use. Next slide, please. The opioid crisis is devastating communities, taxing first responders and healthcare facilities, and leading to an overwhelming number of deaths. It is killing children and teenagers, creating orphans out of children whose parents are lost to overdose, and killing people who have recovered and experienced a recurrence of use. According to the CDC, 1 in every 7 Americans reports having experienced a substance use disorder. The opioid crisis is everyone's problem, and overdose prevention centers could help start the healing. Next slide, please. Overdose prevention centers are an integral part of a harm reduction strategy that focuses on limiting the adverse consequences of substance use. While building non-judgmental and supportive relationships between substance users and healthcare providers, overdose prevention centers help individuals stop using drugs when they are ready. Overdose prevention centers do not provide or endorse drug sales or drug use. These sites allow folks the opportunity to use without being rushed, which lessens the amount of use per session and creates a safe space for less erratic using, reducing the likelihood of overdose abscesses. Next slide, please. Overdose prevention centers play a crucial role in harm reduction strategies aimed at minimizing the negative consequences of substance use. These prevention centers offer education and support to help individuals make safer decisions, reducing the harm to themselves and to their communities. Next slide, please. Vancouver's Insight Clinic has been operating since 2003. Research into the community impact of Insight and other similar programs around the world shows that overdose prevention centers have a positive effect on community safety, reducing the rates of public drug use and discarded supplies without increasing substance use, violence, or property crime. The evidence-based facet is that safe overdose prevention centers make neighborhoods safer. And I'll go ahead and turn it back over to Jamie. Thanks so much.
Thank you, Christine. So how do we get an overdose prevention center started in El Paso? Well, first we would need to change local and or state policy. We know that overdose prevention centers remain illegal at a federal level. However, states like Rhode Island and most recently Vermont have been able to pass bills in their states to legalize or to sanction overdose prevention centers in their community. And so we hope to replicate something like that either on a state level in Texas or locally here in El Paso. To do so, we need to gather advocates, government officials, personnel with social services, as well as health organizations as our allies, and to gather political and public support, as well as to navigate federal opposition. A good place to start is with presentations like these and meeting with individuals at a state, a local, as well as national level. So we've met with our county, and we hope to meet with our city representatives soon to discuss how we can get started here to garner allyship within the local government and then to move out to a state level. We also want to establish a drug users union here in El Paso. So we know that there's a really great drug users union that's operating out of Austin, and we hope to replicate something like that here in El Paso in order to give people that are using drugs a voice in being able to shape policies and programs that directly affect their lives. And so what we're working on right now within the El Paso Harm Reduction Alliance is a proposal for overdose prevention centers. And we've been meeting with organizations around the country, like the folks out in Rhode Island who have been successful in opening up overdose prevention centers in their community to get ideas about how we could do that here in ours. We want to be really intentional about identifying the right locations needed for overdose prevention centers by utilizing heat maps with what we know about overdoses that are occurring both fatal as well as non-fatal in our community, which we do with existing software. I do want to mention that we're very intentional about protecting people's identified information and making sure that that information is not used to increase policing of an already very marginalized community. And we also want to build relationships with communities of people that use drugs. And we do that with our outreach activities and making sure that we are getting supplies to people who most need them, things like Narcan, as well as harm reduction kits. We also want to bring attention to the racial injustice that exists in drug policy. So, for example, one of the bills that was passed during our last legislative session was a drug-induced homicide bill. And in other parts of the country that have enacted similar laws, they have seen that disproportionately people of color are arrested underneath these laws or because of these laws. And they also do not affect overdose deaths in reducing them. They actually create an increase in overdose deaths. So we want to be able to offer an alternative to these draconian, ineffective laws with evidence-based interventions like overdose prevention centers, which are not only compassionate responses to the overdose epidemic, but also are evidence-based and do help to reduce not only the deaths associated with overdoses, but also all of the information that was given to us by Christine and Chris. You know, they help to reduce the spread of infectious diseases. They help to save money. Speaking of money, we can use existing opioid settlement funds to fund an overdose prevention center. And so Rhode Island has used their opioid settlement funds to fund their overdose prevention center. And we could do something like that here in our community as well. These opioid settlement funds were awarded because of the role that pharmaceutical companies played in helping to create this epidemic. And we want to make sure that those funds are used in a way that's going to positively impact the lives of people that use drugs and the lives of people that have been impacted most by this opioid epidemic. And we want to make sure too that these monies and these programs are building on existing harm reduction programs. So here in El Paso, we have really great organizations already doing harm reduction work, drop-in centers, places like the Recovery Alliance of El Paso, Proyecto Sanaremos, Punto de Partida, Emergences Community Health Worker Program, Aliviane providing Narcan, Trinity Homeward Bound providing detox and access to MOUD, Harmony who's providing Suboxone, and Sober Living Homes. So many great organizations. Project Vida is also providing harm reduction services that are already doing the work and can expand on the harm reduction interventions that they're not able to participate in because of the laws that are impeding them. And so making sure that these programs that are already doing amazing work are given the funds needed to expand into overdose prevention centers should they want to. And we do that also by securing political champions, exposing local officials to overdose prevention centers and overdose prevention centers that are operating, not only internationally, but also within the United States. Another idea that we've explored is authorizing a research pilot, similar to what Behar County has done with their Safe Syringe program. We can replicate something like that here in El Paso with our state health and human services. That is another option. We also want to make sure that we're involving people with lived experience, people who use drugs, people with histories of substance use to make sure that we're being truly responsive to the needs of the people that we are serving. Also engaging with diverse partners and supporting allies in similar causes like HIV prevention, for example, and using different tactics to get support from policymakers. We want to attract media attention with presentations like these to raise the profile of overdose prevention centers at a public level. And we also want to provide political cover for supportive elected officials. I want to thank my co-presenters, Chris Bailey, Christine Zimmerly, Mariah Alvarez, for your time, and also Jamie Diaz and Jorge Puentes for helping also to create this presentation, and for you for listening to our presentation. If you want to get involved with the work that the El Paso Harm Reduction Alliance is currently involved in, please feel free to reach out to us at our social media. On Instagram, we are Afro for Change, and on Facebook, we are the El Paso Harm Reduction Alliance. You can also reach out to us if you need any harm reduction supplies. That includes Narcan, harm reduction kits. If you need any assistance connecting to services, we are here. We're happy to support you in any way. And again, thank you for your time. And here is a list of references that we use for our presentation if you are interested in some further reading on overdose prevention centers. Thank you again.